We're speaking here with Bernard Dreyer, who is a professor of pediatrics at NYU Grossman School of Medicine, where he directs the Division of Developmental and Behavioral Pediatrics. He previously was president of the American Academy of Pediatrics, and I'm thrilled to have the opportunity to speak with you, Doctor.
My pleasure, actually.
Great. So as I've mentioned, I've been making a short documentary about how my young children, my 3-year-old daughter Josie and my 5-year-old Vera, have been handling the coronavirus pandemic and how children in general have been handling the pandemic. So my first question is, what do you think are the best ways to speak to our kids about coronavirus?
So, of course, you're focusing on young children, but it depends upon the age, even among young children.
Mm-hmm.
So for very young children, I think they primarily need reassurance that they are safe,
mm-hmm.
That they're staying indoors to be safe, and that you, as their parents, are going to make sure that everything is okay.
Okay.
And you are okay. If, I think those are those. I think as kids get older, they will have specific questions like what causes this?
Mm-hmm.
Why are we staying indoors? And then I think my general advice to parents is to give relatively simple answers to the concrete question you're asked, not go off on a treatise about the various aspects of coronavirus, because they may not be really thinking about that yet. So, for example, if, why are we staying indoors? It's because there's a new infection. It's a virus, just like when you get a cold or people get the flu, but this is causing some people to get very sick. So since just like when you get a cold, you catch it from other people, they're wanting to keep people safe by having them stay home. That would be one answer. Now, if they said, well, what virus is this? I think you can then say, well, it's something called COVID. It's a new virus, and we're learning more about it, and then see what other questions that they ask.
Right. So kind of giving them the information they need, but also giving them enough space so that they can ask their questions as well.
And, I think I find not 2 or 3-year-olds, but certainly 5-year-olds
for sure
are they're into why is the sky blue,
right,
of their lives. So they often have multiple follow-up questions.
Right.
Their follow-up questions may not be the things that you think they're going to ask. So that's why I would say give them some relatively straightforward answer to their first question, and then give them the opportunity to say, but why is this? Or, well, what about that? Or, I have a 5-year-old granddaughter. I think I said to you last time we spoke, who I Skype with or Zoom with pretty much every day. And she's always asking me more questions, So I think also that for some families where there may be somebody sick in the family, I think that's another story. So they may have concerns like why is grandma or grandpa in the hospital? And you at that point you could say, well, older people are more likely to get sick from this new virus than younger people, and so they're in the hospital, and hopefully they'll get better. So they may have concerns. I think for school age kids, of course, they will want to know all the details. Like, what kind of virus is this? I heard it's an RNA virus. What does that mean? So you need to be somewhat of a medical scientist to be able to answer all their questions when they get to school age.
That is for sure. I mean, with my daughter, Vera, who is 5, one of the ways I've reassured her, I said it's not very likely for children to get sick from this virus. Right. But then she's, like, why? And I'm sort of like, I don't really know. Some of the questions are difficult to answer, but I think as long as you're doing your best, then
exactly.
hang in there. Yeah.
Yeah. And so We don't really know why exactly. So that's a good answer.
Yeah.
We have some thoughts, as you know, about why. We think that children's immune systems don't overreact, which is one of the problems adults get, that their system overreacts to this, that causes something called a cytokine storm. And that's what really is causing the severe lung disease that many of the adults are having.
Mm-hmm.
Children's immune system may, may not be ready to do that kind of thing, so that paradoxically could protect them.
Mm.
There are other theories, such as many children see other coronaviruses a lot in early childhood. Coronavirus is one of the most common causes of upper and lower respiratory disease in all of us, but certainly in young children.
I wasn't aware of that.
And so it's possible, although again, we don't know, that there's some cross-reactivity with these other coronaviruses, like the, what I call the brown paper bag coronaviruses that causing lots of colds and chest colds in kids, and that slight extra immunity is protecting them, but actually we don't know that either.
Interesting. So what?
A lot of the adults have chronic disease, and in fact, even among adults, it's mostly those who have underlying diseases, including obesity, heart disease, lung disease, diabetes. Those are the adults that are often getting sickest. So little kids especially mostly don't have any of those diseases, and so that may also protect them.
What do you think are the different ways that children might process this event as they grow older?
Yes. So I think for young children, they may process it as something bad. I just today had a conversation with a family whose young child is on the anxious side. So I think one of the things that is going to make a difference in how children process this will be their underlying personality. There's some kids that, everything rolls off of them. They're not really interested. They're doing their own thing. Other kids are much more sensitive and often get anxious more. So this was one of those kinds of kids, perfectly normal, but, on the anxious side. And so he was waking up every night several times, prayed, and was really fearful that there was some man. He sort of personified it. That there was some man outside that was trying to get in and hurt them.
Oh, wow.
So that's an interesting thing to think of. Which kids do a lot of. They still believe in ghosts and people that are evil, etc. So that's how he dealt with it, by sort of externalizing it to some man out there who's trying to get in to hurt them. And his parents needed to reassure them that every door is locked, every window is locked. We're here, mommy and daddy will protect you. He can't get in. You're okay. You're safe.
Right.
Regarding how kids process the trauma, I think for some of the older kids, I think focusing on all the details is one of the ways they process it. We know that many kids, once they can learn all about it, they feel they've mastered this thing. It's no longer a mystery.
Right.
So for some kids, I think helping them learn all the details is what makes them feel better. One thing that's interesting about COVID is that, of course, it's traveled around the world. And whether you want to say that it came from China first, that's not even relevant, but it's gone from country to country to country. So some kids might get into following where it is. How are these countries related to each other? How do you get from one country to the other? And sort of it can become a sort of geography lesson. which in fact, again, is their way of processing some control over the mystery of this.
Interesting.
Understanding what countries are near each other, how do you get from one country to another, where are all of these countries where this is happening. So for a 5-year-old who may not yet know that much about geography, this might be one way that they begin to explore it. Or a 6-year-old, or a school-age kid. Actually, many adults don't know that much about geography. I think other kids are potentially traumatized. It really depends upon how their life is turned upside down. So I think it's mostly dependent upon the parents. If the parents are very anxious and distraught all the time, then the kids will feel very, very anxious and distraught. Now, I'm not telling parents not to feel anxious and distraught, but I think
it's an anxious time.
Just to recognize that your kid's anxiety and sort of emotional trauma is going to be in many ways directly related to how they perceive your feeling. So think about that. Doesn't mean that you won't feel distraught. I think one of the things we know is that poor children and minority children are often having more problems with this, mainly because a lot of the families are not even having enough food in the house. So it's one thing to be staying home and eating and not have to worry about that, but to be in a household where you may not have food, or you may not have any money to buy anything or to pay the rent, because many of the poor families, they're low-wage earners. They're the first to be let go, but also they have no savings. So those kids are in families who are really being stressed, both regarding food and regarding just cash, money, to buy anything, to do anything. And I think that's probably much more frightening for them and potentially more harmful to them than, being in a family where it doesn't impact your ability to eat or to do the other thing other than staying in. It's not impacting you in some very, very basic way.
Right. Can you speak about some of the ways in which you think the outcomes might sort of vary across classes, socioeconomic classes?
Yeah, well, I think I've just begun speaking about it. But for example, one big area we worry about is academic progress.
Right.
Many kids are being homeschooled or, online schooled with some help from the home. And many poor kids don't even have really good internet access.
Right.
So they really can't get online learning in the same way. Right. Plus, they may be living in very crowded, not that some of us who are not poor are not living in very crowded households, but they may be living in very crowded households with multiple generations, that it's not just easy for them to sit in a quiet place and focus on what the teacher is trying to have them do online.
Right.
And their parents may have many other responsibilities and can't just sit with them and help them understand what's going on with their online learning, even if they have internet access. So I think one area that many of us, especially in pediatrics, are concerned is that the already academic differences that and disparities that poor children have compared to middle class and upper middle class children will be exacerbated by this pandemic, because they're going to now miss a large chunk of the school year in addition to their usual. We know that poor children, every summer lose some of their skills. This is sort of a well-known summer loss of about 3 months of their reading and math levels. Again, because unlike upper middle class kids who have all sorts of enriching experiences. They don't much in the summer. And so they often, in fact, lose some skills. And there are thoughts about how to do something about that. But
that's interesting. What do you think accounts for that loss of skills for?
Well, I think they are already behind. Their understanding is not complete yet. And then they're in sort of, when you think about school, somehow one thinks, well, it's the end of the year, but it's not the end of your math learning on multiplication. You're really in the middle of that.
Right.
And so you're not, it's not completely there yet. And then goodbye, see you in 3 months.
Right.
So during that 3 months, it's not being reinforced and it's continuing. And so there's the potential, there is more than the potential to sort of go backwards a little and have to start over again. Not completely over, but somewhat over again.
Right.
I think that to some degree may happen to middle class kids as well. But I think mostly they're in a better position regarding where they are in their academics. And then often, even though they may not be learning math, they're having various experiences where they're using math.
Right.
Or they're given reading, in their camp. So they're reading all these books, whereas poor kids aren't necessarily giving reading lists to read over the summer. And nobody's buying those books for them necessarily or helping them go through them.
Right.
So things like reading and using math may fall by the wayside over the summer. But now this is endless summer.
Yeah, exactly.
Yeah. And that has nothing to do with surfing, That has to do with the fact that we've cut off a significant portion of the year. And even for middle class kids, online learning is not as good as going to school every day. But certainly they may have parents who are reviewing their lessons with them and helping them do all they're supposed to be doing, maybe being driven a little crazy by that, but nevertheless doing it. And poor kids may not even have a good enough internet connection to really participate.
Yeah, we do a group Zoom call with my daughter's kindergarten class, and there's kids from all different types of socioeconomic classes, and you see that a lot. You see the kids who are from the middle and upper classes who have a good connection and retaining their skills, but the kids who are perhaps on a meal plan or something like that have a more difficult time gaining access. Right. So let me ask you on a different topic. I mentioned previously when we were talking that my daughter Vera really likes to use imagination and play in order to cope with this, and she is actually likes to put on little shows. And one of the things she likes to do is pretend that she's at a coronavirus party that's only for kids, and adults are not allowed because the adults are the sick ones. And it's pretty hilarious and also seems pretty like an interesting way of coping. What do you think? What do you think are the ways that children utilize imagination and play?
Certainly imaginative play of various kinds is really the work of childhood in some ways. And it starts really at 2 or 3 years of age, but it doesn't stop when they get to be 5 or 6. It really continues after that as well. And it is definitely a way that they can work out and be their understanding of it, but also, as I said before, get control of it.
Right.
Feel like I'm in control of this. And by acting out and, being bossy to the adults, as your is, and saying, we're in charge, she's empowering herself and other kids to feel like, they can lick this virus and they're really, more powerful than it is. Now, I saw an interesting thought. I don't know if I saw it I think in the New York Times,
Mm.
of creating a piñata
Mm.
in the shape of a coronavirus
Oh, that's interesting.
and then smashing it.
Yeah.
I mean, so which would give kids a lot of control over, that, I can do that. I have to think about what you should put in that piñata.
Yeah, right.
You don't want like little viruses coming out,
Yeah.
but it's, maybe just paper mache things, whatever. But it was just an interesting thought about the way kids might be able to get control over coronavirus. I think certainly um, um, also what we call in pediatrics medical play, may be another thing, setting up a little hospital clinic with dolls and, little blankets to put over people and tending to their problems. And, that I've seen, I know that a number of kids are doing that kind of thing,
Mm-hmm.
which again, giving them the adult roles that are helping people and controlling this thing and making them feel that they're part of the solution, but also they can deal with this as well.
Yeah, that's interesting.
Yeah.
Go ahead.
I think for teenagers, there's been a lot of talk, and I think it's true that volunteering, or even older school age kids, volunteering to bring meals to elderly people in your neighborhood who may be stuck at home, or other, or giving out food to poor people in your neighborhood. That and that can be pretty safe.
Mm.
And of course, their adults in their family have to be involved as well. But to me, that would be a great thing to get kids involved with. I think the the fancy word for that is service learning.
Mm-hmm.
And, service learning is good for everybody. But I think the pandemic has made a big thing about people who serve.
Mm.
And so it is an important thing for kids to try to emulate that and participate in that. And I think I've seen a number of teenagers and even school age kids that get involved in those activities. And not only are they helping other people, but they're really feeling good about themselves and learning a lifelong lesson.
Right.
About that we're all in this together. And if I'm okay, I need to help people who are not okay.
Right. We have a food bank in our town, and we, on one or two occasions, have just, had the kids put stuff into a box and then we take it in. That type of thing.
That's another thing you could do. Exactly.
Mm-hmm.
People need food desperately. So that's great.
Yeah. And in terms of mastery, one thing we did this morning is we made a tornado in a jar, but that got us talking about tornadoes and how, destructive they can be. But then we talked a little bit about how communities cope with it. And we made the bridge to how people cope with terrible things. And it can be okay. And I could see the wheels turning with my 5-year-old. It's like, if a tornado came, we would handle it. We'd be okay. And it's the same type of thing. We're handling it now, with coronavirus.
Well, after this show, you have to tell me how you made a tornado in a jar. Our time now.
Yeah, it's just dishwashing detergent and swirl it around. But it's a lot of fun. So what are the questions? How about how should we screen for adverse outcomes after we return to normal? I know that's a big topic these days.
Yeah, it is a big topic, and it's important because we assume there will be adverse outcomes.
Right.
Hopefully, if families did all the things we've just talked about, those adverse outcomes will be at a minimum. Mm-hmm. But we expect there will be, and especially for kids like that boy who was shy and somewhat anxious to begin with, mm-hmm. he's more likely to be traumatized by this kind of scary thing than other kids. Mm-hmm. So I think we do a lot of screening now in pediatrics. So the first thing is to get people to see their pediatrician. Mm. One of our other concerns is that kids are not getting immunized as much as they should. But leaving that aside, pediatricians do a lot of screening. They screen for developmental problems. So they could screen for kids who are now not doing as well in school and find out about that. We do screening for social and emotional problems, including things like anxiety, depression, or acting out, having acting out behavior problems. And so those kinds of screens, which could even be done over telehealth, they wouldn't necessarily have to be done in person, should be done to find out whether these kids have underlying problems, but even more so to see if in the aftermath of this that they've developed these problems. And then, of course, getting back to those families who have been hit hard financially, we also do what we call screening for social determinants of health, which primarily gets to screening for food insecurity, housing insecurity, not having enough money to pay the rent, et cetera. And we routinely do that now, but that will be very important. We're doing that in Bellevue, where I'm the director of pediatrics. We're doing that now by telehealth for those patients that we're contacting, and then trying to connect them to community resources, of which there are many. But I think that will be very important when we return to normal, to make sure that families have enough assets to survive, because a lot of jobs are likely not coming back, or not coming back right away.
Right.
And so food insecurity, lack of money to pay the rent, or, I always talk about the importance of diapers in early childhood. Think about if somebody took all the diapers away from you when you had little children.
Yeah.
And you don't have any diapers, So diapers are not covered by any public program.
Oh, interesting.
Medicaid doesn't cover diapers, and food stamps don't cover diapers, and so diapers are purely purchased by parents with cash. And so when you don't have enough cash to get food, are you really going to get diapers?
Right.
But think about kids living without diapers, or you reusing diapers, or whatever. It's actually a potentially serious problem for poor families. One of the things we've done here in Bellevue is we've sort of developed our own diaper bank. We've gotten donations of many, many diapers, and we're giving it out to parents when they come in, because that's the one thing, for those families that have little children in it that are still in diapers, obviously, that parents, doesn't matter if they have health insurance, doesn't matter if they're on WIC, which gives them formula for their kids. It doesn't matter if they're on, food stamps. They still need money to buy diapers.
Right. And what's the name of that organization, just out of curiosity, that you can donate to, that would help out with these types of resources?
Well, I think there are, what I would suggest is there are diaper banks pretty much in every city.
Okay.
And I don't know that I know the name of the diaper bank in New York City.
Okay.
But there are diaper banks everywhere.
Okay. So you can just sort of Google it, and you're on, near me.
Yes, and I'm sure they all need money.
Right.
That would be, and food pantries need money too.
Right.
So I think if you want to give money to help poor families, unless you can give it. There are other charities, like in Bellevue, we have an auxiliary called Children of Bellevue, which raises money for poor kids.
Mm-hmm.
So, in general, I give a lot of money to them to buy things for poor kids. And right now, among the things they're buying are food and diapers and cards with money on it so that they can go buy things for the family. But I think regarding something like diapers, I know there are diaper banks pretty much in every city, probably in many towns as well.
Okay, great. So switching to a different topic, what skills do you think children might learn from coping with coronavirus?
So I'll start out by being honest.
Okay, for sure. Or will they learn anything? Or is there anything to be learned?
I think mostly it's not a positive. You know what I mean? They're cooped up all day. Some of them are having a delightful time with their families, like they're on vacation. Mm-hmm. They're both parents at their beck and call, and that's amazing for them because they usually never have that. And kids are learning to cope. Mm-hmm. So I think some of the things we talked about, how kids are learning to cope through imaginative play, through perhaps volunteering if they're older. I think those are they're good things for children to learn, and I guess I don't know about skill as much as understanding that we are really part of a community. Very frequently, even in a city like New York, which has, famous for its crowding, mm-hmm. caused a lot of the COVID to spread. Nevertheless, people don't necessarily feel they're part of a community.
Right.
They're in their families, they're in their apartments, they go to school, they go to work, they come home. This has made, I think, most of us feel we're in it together. And I think that's a lesson that children can learn, that they can take away from this and realize that if they want to thrive themselves, they need to make sure that they're helping others and making their communities thrive. On the other hand, as far as, I think that's the major lesson. And also learning that I can cope with this. Who thought a 5-year-old could be cooped up at home for 2 months and not go crazy? Well, guess what? I've learned all these things. I've been reading. I've been playing games. I've Skyped with my friends. I've done this imaginative play. Isn't that great?
Right.
I think it's really empowering in that way. But mostly kids really need to socialize more than they're socializing now with their peers. They need to go to school and really have a much more rigorous academic. When I say academic, it sounds very impressive, but I really mean learn whatever the skills they're supposed to be learning at their age.
Sure.
Preschool is one thing and school age is another thing. And they need to do a lot of physical activity. And some kids are getting to do some physical activity, and that's good. This is one of my recommendations or questions to every family I speak to is, does your kid get out? Does your kid, get out in the fresh air? Does your kid walk or run, or can they play outside? Or, what can you do to make that happen?
Yeah.
Because I think for children, exercise and, learning skills that you get from that, riding your bike, throwing a ball, all of those are the things that children are missing. And so in any way that we can make up for that, that would be a good thing to continue to do. And then, like after this is over, to make sure that you do that, you double down on those activities. I mean, imagine all these kids are on sports teams, or even if it's a junior little sports team, they're not playing those ball games or soccer games or basketball games or dancing or any of those things, those have really been cut off for them. So I think getting them back into those activities as quickly as possible, we know is critical. We know that children learn better when they're physically active than when they're not physically active.
Great. That's hugely informative, and I really appreciate you taking some time to answer some of these questions. It helps me to think about how I might edit this piece together, but it also helps me as a parent as well. So I appreciate that. But that's all I have for questions, and unless there's anything else you'd like to address.
No, I only think that in general, this has been a pandemic that has attacked adults, especially older adults. That in general, and which is something we need to be thankful for, it has spared children. And now there is some reports that a few children are getting sick with not mysterious illnesses, but illnesses we know, but are not usually associated with this virus. And some of them, a couple of them have even died. So we are a little concerned, but even now, still the vast majority of kids are not suffering from COVID at all, which as I said, is something we should all celebrate. But the flip side of that is that the problems of kids or the needs of kids have frequently been ignored. Again, somewhat rightly so, because I'm in a hospital where, at our peak, we had hundreds of deathly ill adults with a number of dying every day. So, yeah, we didn't have that in pediatrics here, which is good, but nevertheless, it meant that everybody's focus, including my focus, was mainly on those adults. But I do think, and that's why I'm glad you're doing this, because I do think we need to make sure that we still focus on kids' needs, because their needs, their problems are mostly collateral damage rather than direct damage. But they still are collateral victims of this pandemic because their lives have been turned around. As I said, for poor kids, they may not have food. They may, kids are being robbed of part of their childhood, and that could, and if they're traumatized, that can have lifelong implications. So I think my general message is, thankfully, kids are mostly not impacted directly, but let's remember that they're collateral victims, and they are our future, and we need to make sure that the problems that they're having are vigorously dealt with by the government, by parents, by communities, by all of us.